here again with Dr. Nario, Biointegrative Health Center. Biointegrative Health Center, as you know, if you've been watching us, is in Reno, Nevada. You can check them out online and see what kind of treatments they do. You can also check out the different interviews that we've done together on this channel where we talk about many, if not most, of the IV treatments that they do. So, welcome, Dr. Nario.
Hi, Steve. Thank you for having me again. Always a pleasure.
Okay, so let's talk about fiber. And if you guys have questions for the doctor or questions about fiber, whatever, just put them in the comment section and we'll get back to you on that. Questions about anything. So, what is fiber?
Well, Steve, that is a very good topic to talk about, especially if you're in the nursing home. Why is that? For the reason that I have a lot of patients who are elderly and having constipation issues. So these are the top hot topics in the dining table in the morning. But going back to your question, fiber is actually a dietary material containing substances such as a little jargonish here, cellulose, lignins, pectins, but they are all what we call, I guess, uh, more plant-based sourced fibers, and they are resistant to the actions of our digestive enzymes. And meaning they most of the time they stay as it is even after digestion. But there are two types of fiber. One is soluble and one is insoluble. Soluble fiber dissolves in water and can be used to be as food by your good bacteria, while the insoluble fiber does not dissolve in water and passes through your digestive tract. It serves as the bulking agent of a stool, meaning it's more of your uh, it gets bigger and bigger as it goes through your gut and collects all the junk and gunk to get out of your bottom. And here, when we talk about, you hear about laxatives all the time. It's the most common drugs actually that are out in the market that are being used. They are safe, but if used intermittently only, and most of the time, my patients, they're not on that route. They're using it all the time. They're so dependent on it, thus increasing the frequency of use of these laxatives ends up being one of the most common causes of adverse drug reactions. That's why treatment should be focused instead to address the underlying problem. And this is actually the lack of fiber in the American diet. And we're always conscious about the lack of protein for the muscle, for, of course, tissue repair. But the American diet that is standard always lacks more in fiber.
Hmm. Okay. So that kind of gives me, I want to ask, why is it important? You've kind of given me an indication of why it's important, but can you elaborate on why it's important?
Yes. Well, Steve, if you want to have good mornings, if you want to have good days, you don't want to have constipation. That's the main one that I always see with patients. When you're The grumpy ones are the ones who are constipated. The thing here is because abdominal discomfort and pain, straining, hard stools, infrequent bowel movements, bloating and nausea, all of these are part of the manifestation of severe constipation. But also for fiber, it helps get rid of excess bile, feeds our good bacteria, it changes our gut hormones, also helps our cholesterol be controlled and body weight. Blood sugars are lower and blood pressures also. And also the reduction of the risk for cardiovascular disease is actually one of the better uh, effects that I promote fiber for my patients. The perfect example, to be more specific, is the greater the dietary fiber intake, the lower the risk of heart attacks and strokes. Almost 9% would be a lower risk for every additional 7 grams of a day of fiber that you consume. And another one is reduction of inflammation, thus preventing chronic disease. And good bacteria, they eat fiber for breakfast and release what we call butyrate into the bloodstream, which is a compound that also has a broad anti-inflammatory action.
Okay, so how much fiber do we need? Does it matter gender, size, age? Um, how much should we eat?
Well, Steve, if you ask me, you're talking to a vegetarian, I would suggest sacks of it. And again, how realistic would that be? Not really. But according to the current standard recommendations for fiber intake, okay, men and women are different. So women should try to eat at least 20 to 25 grams of fiber a day, while men should aim for 30 to 38 grams a day. So there's so many factors why those numbers are, but it's just, of course, as you know, men always not on the good side of diet. Women has a predilection to be more on the healthier type of diet. Not all, it's a generalization, but this is related also to the activity, how big the body mass of a man is versus a female, and also the activities that they do every day.
That's interesting. It's kind of like it's something you have to pay attention to if you're trying to get a certain amount of protein. But if you're trying to get, it's the same as if you're trying to get a certain amount of fiber. I know for me, I got to pay attention to it. I've got to
Uh-huh.
pay attention and consciously get fiber in certain foods to get to 30 or 40 grams. I mean, I can get to 50, but you got to really, for me, in the way I eat, I got to really pay attention, which I do, to make sure I get that fiber in. So,
Right.
um, what kind of foods are rich in fiber?
Okay, so this is where we suggest specific, uh, I guess, food sources for our audience here. So let's go back to our different types. Soluble fiber first. So soluble fiber is found in oat bran, barley, nuts, seeds, beans, lentil, peas, fruits, and vegetables. And also the most common that you would hear is the psyllium husk, and this is a common fiber supplement. And again, these are also soluble fibers that may help lower risk of heart disease. In relation to insoluble fiber, wheat, whole grains, like brands, nuts, beans, also vegetables such as cauliflower, green beans, and potatoes are good sources of insoluble fiber. But as you can see, there's so much overlap within the two that it's really not sometimes worth, I guess, splitting the classifications up. The main focus here is they are all plant-based. That's why with the diet that we recommend, I recommend for my patients, being plant-based, you're for sure going to hit the mark for a fiber requirement for your everyday. And here's some facts that I want to put out there. Fruits and leafy vegetables are the poorest whole food sources of fiber. Okay, that's pretty striking, right? Why? Because they are 90% water. And root vegetables have more, but the fiber superstars are legumes, which means beans, split peas, chickpeas, lentils, as well as whole grains. And the gram for gram for this would be fruit fiber doesn't seem to have the same effect. It may take 25 grams of fruit fiber to double the stool output, something just almost 10 grams of a whole grain fiber or vegetable fiber can do, meaning you need less to get that stool outcome from these specific sources that I just mentioned, versus you need to take more of the ones that are not part of that list that I just mentioned.
Okay, well, that helps a lot. And people can do some research, look up some of these foods that the doctor mentioned and see how much fiber is in a cup of spinach or whatever. So those are good foods to eat. Thanks, doctor. That's Dr. Nario, Biointegrative Health Center, again in Reno, Nevada. Check them out online. Thanks for being with us, doctor.
Thanks, Steve. Always a pleasure. As we all know, knowledge is power, and thank you for letting me provide you with edge in longevity and health maintenance, which I call the biological edge or the bio edge.